Right now, over half of adults with mental health challenges in the US are not getting the care that they need. That is 28 million people who need help, but they cannot reach it. It's not that they don't want help, but it's getting to the clinic that feels impossible. It could be long drives, no rides available, or wait lists expanding months. But what if the clinic came to them instead? And that is exactly what mobile mental health does, and it's changing everything. Everything we talk about in this video comes from our free download, Your Complete Guide to Mobile Mental Health. It covers way more than we can fit into this video, and it's free on our website. And I've included a link to that below. So let's talk numbers. There are nearly 60 million adults in America who are currently suffering with a mental health illness. That's roughly 1 in 5 people. And yet, more than half of them are not receiving any kind of treatment. And so the question is why? There's a massive gap between needing the help and actually getting the help. In some rural counties, there's only one mental health provider for every 30,000 people. Think about that. One person trying to serve an entire small city. Now here's the thing. Mental health doesn't exist in a small vacuum. It's part of a bigger picture which we call behavioral health. That includes mental health, yes, but it also includes substance use, lifestyle choices, and all the behaviors that affect someone's physical and psychological well-being. When someone cannot access mental health support, some of those other things fall apart as well. Transportation alone is one of the biggest barriers. If you don't have a car or the bus doesn't run near the clinic, you're out of luck. And so someone who's already dealing with anxiety or depression and trying to get a ride across town can feel like traveling across the ocean. So here's where mobile mental health comes in. It's exactly what it sounds like. Counseling and therapy delivered on wheels. Instead of waiting for the people to come directly to you, you bring the care directly to them. These are not just vans with a folding chair in the back. They are fully equipped mobile health units. Inside, you'll find warm, cozy places for counseling, climate control so people can relax no matter what the weather, storage for resources and supplies, Wi-Fi for laptops and telehealth when it's needed, and everything a traditional counseling office has except on wheels. You might hear of them being called outreach vans, mobile counseling, or mobile behavioral health units. The name changes, but the mission stays the same, to remove the barrier. And because behavioral health is all connected, these mobile medical units can address all of these challenges at once. Mental health support, substance use counseling, harm reduction resources, connections to other services. Now, let's get specific on how it actually breaks down these barriers. The first is transportation. This is a big one. When the clinic rolls into your neighborhood, you don't need to figure out a ride. You don't need to take a bus or beg a friend for a lift. It shows up right where you are. For example, in Los Angeles, mobile behavioral health units bring services directly into homeless encampments. Teams park, set up, and they offer support right on the spot. They can provide mental health counseling, harm reduction supplies, and connect people to substance use treatment, all without asking them to travel anywhere first. For someone living on the street, that is the difference between getting help and living without it. The second barrier is wait times. In a place where there's only one therapist for thousands of people, a mobile unit can cover way more ground. It reaches rural areas faster and more often than a fixed clinic ever could. Take North Carolina. Mobile units visit rural counties where there's one therapist per 10,000 people. They bring therapy, crisis care, and medication management right to people's doors. Because these teams view behavioral health as a whole, they can also spot when someone needs addictions treatment or help with lifestyle changes that affects their mental health well-being. No appointment 3 months out, just help today. The third barrier is stigma. Walking into a mental health clinic can feel scary. People worry about judgment and who might see them. So a van parked in your community feels less intimidating. You don't need to ask for a ride to the clinic, which can bring up questions, or request time off work to go. In Chicago, mobile crisis teams respond to a mental health emergency rather than the police force. So the city's care program pairs clinicians with paramedics. People get the help without the fear of being judged or arrested. The fourth barrier is cost. Many mobile programs offer free or sliding scale programs. They work with local health authorities or nonprofits to cover expense, and it makes care affordable for those people who otherwise couldn't afford therapy. And finally, trust. When the same mobile team shows up week after week, people start to recognize faces. And so someone who's too nervous to talk on day one may open up on day 5. Trust takes time, and mobile mental health builds that trust. The beauty of mobile mental health is that it goes anywhere. Rural communities with no clinics nearby, schools and college campuses, homeless shelters and encampments, community centers, public events or places of worship, even local jails or re-entry programs. Wherever people gather, a mobile behavioral health unit can go. It's flexible and approachable. If you're working in healthcare, nonprofits, or community outreach, and you want to dive deeper into mobile mental health, head to our website and download your complete guide to mobile mental health. It's packed with everything that you need to know about launching a mobile program, from understanding the barriers to choosing the right vehicle for your community. Click the link below to get your free guide. If you have any questions, drop them in the comments below the like button. We're always here to help.